we have Shahzad Hashim. He's the Chief Product Officer from blueBriX. And is going to be talking about the development of an oral medical device. Shahzad, welcome and take it away.
Thank you so much. Good morning, good afternoon, good evening, everybody, being an online session. So I'm going to be talking about a journey of one of our clients, Vivos, who was one of the first developers of an OSA appliance, and how they brought our technology and their workflows together to manage the delivery of their services. First off, about me, 17 plus years, almost third company that I founded. I think that's enough. And then about our company, as you can see on screen, we have been 15 years in healthcare. We've had developments and implementations in over 3 continents. And we are looking at ourselves as a platform in healthcare, which is focused on value-based healthcare. Coming to Vivos, right? Vivos is an organization which actually built the first ever FDA-approved oral device. One of the challenges that they were facing was once the device was actually created, they had to get into the ecosystem of sleep study in order to make sure that they can really sell this device. And one thing was to get into the dental offices. The other thing was to get with manufacturer referrals and actually bring all of this into one ecosystem, but seamlessly managing communications, managing data security, etc. So one important thing when you look at the challenge that Vivos was facing was about once they have a patient who is ready to go about, instead of taking a CPAP and OSA route, how do they engage them in the real sense, right? And what we did over there was to really put together, as you can see on the screen, certain specific strategies of scheduling, AI-driven triages, telemedicine, etc., to bring the patient as a real stakeholder in their care. The next challenge that Vivos had was, they had multiple devices and they had to have an integration, but they also had to have a data representation for the patient, for the caregiver, and for the referral entity, which can be a doctor or anybody else, to actually have a data representation that really made sense. And to be able to integrate more than one devices and bring all of that data into one view. And that's where, our reporting, our integration engines, and the ability of having a scalable cloud infrastructure was brought into picture in order to actually achieve that. One of the other things that Vivos actually had a challenge in coming with the expansion mode was their beginning was the OSA device and the ecosystem around that. But they have a unique proprietary methodology known as the Vivos method, where one of the pieces is actually digital engagement of these patients. So what do I mean by that, right? The ability to provide self-help or control self-help with therapist for myoskeletal therapy. A simple app which has, a 15-day program or a 13-day program with videos on how they need to, do exercises. Because one thing is to have the OSA device, but the other thing is to also make sure that their disease gets better, or, the patient gets better. In this regard, they also wanted a platform where they were able to actually expand the digital therapy wing of it, and it all had to be under one strategy in regard to it. So if you look at this, although I don't have a pointer, I'll be just trying to do a visual over here. So if you really look at it, the first parts of the implementation was actually looking at how do you bring the dental and the referral providers multiple databases to be able to communicate for the revenue cycle problem, so that when a patient came in from induction to consent, there was a way that the dental office could press a button and a dashboard module for centralized RCM, so the patient's name would come, where the backend processors from the Vivos team would actually process the revenue cycle or the insurance eligibilities, etc., and communicate back to the dental offices. The second phase of that was how they were able to actually look at the external referral organizations like Lincare, etc., where they would actually give list of referred patients into the Vivos network, and be able to actually drive them through the Vivos method to actually have OSA therapy through their medical device. So here we actually created a dashboard and a referral module in regards to this, where they were able to actually put the whole workflow into that. So they would actually the link care organization or the referring organizations would be given a unique ID, so they could actually log in, upload these lists, which would automatically queue up for the Vivos coordinators, who would then run each of those patients through the admission workflows, connect them to the different dental providers according to region, and then drive them to the care. And seamlessly, from the dashboard of the referring agency itself, they could see that out of the list of 100 or 200 patients, where each individual patient was, and be able to communicate securely with the coordinators to actually ask questions and have details, etc. Here, um, they had to have a way in which they could have an app, which was then again given to the dental offices, where they could enroll these patients, and then their therapists and their referring providers could take care of these patients, have clear communication strategies, see data points, send patient educations. And they wanted a strategy where they could start small and build as and when the features were required, or as and when their product management actually moved to different outcomes that we're looking at. And when I say modules, that's where blueBriX comes into play, because we are a healthcare platform focused on value-based care, and we help differentiated organizations or differentiated healthcare delivery organizations achieve their unique way of taking care of patients easily. And our main focus is for organizations strategies to be adapted by the technology rather than vice versa. So that's where the platform play actually comes into play. A pick and choose modular basis, and in an agnostic cloud basis, so that you can actually choose what your actual problem or challenges are, what are the solutions that you're looking at, and iteratively build or configure on the platform, so that you can actually have every part of the solution that you're looking at, build in one place. Again, connected to multiple solutions out there, depending on what your organization really wants to be looking at.
How does a solution like the blueBriX platform help address that in terms of helping healthcare professionals, providers be more efficient in delivering their services to the patients?
Great question. So I believe that, all around the world, every government, every healthcare organization is moving into value based care. This is where the digital technology play actually comes into foray, right? So one is cohort management. As a provider, I should be able to see out of the 100 patients, when and in what level of outreach I need to be giving that patient. How can I put my cohorts into a risk stratification? As in a simple way, how do I bring the patient to a lower risk, and how do I go about doing that? And the system helps me to actually tell me real time, not reactive, but proactively what to do. And that's where we believe that in order for healthcare organizations to deliver that, they more than requiring systems that are best practices, you need applications, one, that are open, second, interoperable, and for a lack of better word, agile to the organization's needs. And I
Yep.
believe that the more you're able to bring systems to do the mundane work, systems to do effective data to knowledge conversation on the screens, that the organization will be able to match and do that. And that's what our platform actually does, be agile in regards to that.
From my perspective, the recent history of healthcare focusing on hospitals and other clinical settings and bringing patients into that. More recently, especially post-pandemic, that tide is beginning to turn the other way. We're seeing healthcare providers creating lots of more satellite programs out in the community closer to the patients. In this country, we've got pharmacies, but also big box retailers setting up healthcare programs for the public. And then we have things like the hearing aid allowing providers to deliver their products directly to the consumer. In fact, we even have now that with the constant glucose monitors in this country that you can buy without a prescription. What sort of challenges does that pose for you and with blueBriX, and and how does that change the kind of support that you're going to be providing to healthcare professionals, but also the device makers?
Correct. I think more than a challenge, we look at that as an opportunity. And I think the key over there, where you talked about healthcare providers and the device manufacturers, I think the key over there, and this century is about patient enablement and patient education to get the patient to really take care of themselves. By providing that to the patients and enabling the healthcare providers, the device manufacturers, although they're individual companies, individual solutions, etc., but to be seamlessly in an ecosystem and giving the power to the patient and the provider to actually take care of the patients is where I see that crux actually coming in. Because I think giving the tools to organizations to be able to not just use one application or just use one EHR, or have to spend a lot of money to integrate another EHR or another device or etc. I think it should be what I would say flexible systems, which at the core are agile to the organizations and the patient needs, so that the organization or healthcare delivery organization can actually decide how well can I service my patients to them to have better outcomes, and also to be able to report back to insurances, governments, funders, agencies, to make sure that they are financially viable.
Excellent. Well, thank you so much. I think that the theme for this session is rapidly turning into flexibility, whether it's sensors or systems to support healthcare. Thank you so much, Shahzad, for your time and your presentation.
Thank you so